Good morning, everyone. I am Dr. Haytham Soliman. I'm lecturer of cardiovascular medicine at Fayoum University and the general secretary of the CME working group at the Egyptian Society of Cardiology. We will discuss today points to remember in grown-up congenital heart disease patient management. There are several challenges of GUCH patients. The lack of transitional zone between the pediatric and adult congenital programs, the deficiency of patient and parents' education, the misdiagnosis till adulthood, the complication after surgery and catheter intervention, and lack of follow-up programs. When dealing with a GUCH patient, there are some points that must be stressed upon, especially in the first visit. So try to know as much as you can about the details of his cardiac anomalies. Refer to a specialist as soon as possible if you're not familiar with the defect of this patient. Try to detect complication symptoms because these patients tend to be habituated to their condition, so they cannot report the symptoms of complications accurately. Stress about the medications and vaccines, and depend on cardiac MRI more than with patients without congenital heart disease. The parents' education is of utmost importance. So you must teach the parents to detect any symptoms related to the congenital heart disease, like poor weight gain, pale or bluish skin, puffy face, fast breathing when at rest or sleeping, sweating, sleepiness a lot, and the easy fatigability. Although the results of treatment, especially the surgical intervention, is promising, but there is no definite cure in most of the congenital heart disease conditions or patients. Except for PDA closure, there is no definite cure. So expect arrhythmia, which is the most common complication after surgery. Expect valvular regurg, especially pulmonary and tricuspid valves. Expect that these patients will have thromboembolic manifestations, venous or arterial, especially for cyanotic patients, and expect and search for chamber enlargement, especially if this patient is treated lately, either from right-sided heart disease or left-sided heart disease, especially coarctation. So what should we check for? We would check for the compliance of the patient on the treatment, the patient follow-up imaging, especially echocardiography, every 6 to 12 months, the patient compliance on vaccines. These patients are extremely vulnerable, so the compliance on the vaccines, influenza every year and pneumo vaccine every 5 years, or of utmost important, the patient diet compliance and risk factor control. And for the cyanotic congenital heart disease, there are particular points that should be avoided, like pregnancy, anemia, dehydration, infectious disease, cigarette smoking and alcohol consumption, transvenous pacemaker or ICD leads, stressless exercise, and acute exposure to heat. Other risk reduction strategies may include use of air filter in an intravenous line to prevent air embolism, the consultation of a GUCH cardiology, especially if you're not familiar with the condition of the patient, pump therapy of upper respiratory tract infection, cautious use or avoidance of agents impairing renal function, and the contraceptive advice in order to prevent, again, pregnancy, especially in cyanotic congenital heart disease patients. I hope these advices are of utmost benefit for you, and thank you so much for your attention.